Good afternoon, everybody. I trust you can hear me quite clearly. I'm Steve Rohan-Jones, and I'll be providing a presentation on mental health at work. For those of you that are yet to be able to use or have yet to use a webinar-based system, I have my chat box open. Feel free to send any questions that you have through. I'll try and take some regular breaks so that we can ask any questions that the group might wish to share amongst us all. So welcome, and I guess at this stage it might be useful to introduce myself quickly. My background and experience with mental health in the workplace. I've written a number of documents on mental health and did a major project with the Mental Health Council of Australia called Weaving the Net, which looked at mental health and community resilience across Australia. With ANU, Australian National University, I did a project building a called version, which is a version for the, in this particular case, for the ethnic groups of Italy, Croatia and Vietnam, of the Mental Health First Aid Awareness Program, and that involved ensuring that it was relevant and also in the relevant language, which was one of the issues that I had to ensure happened for the project. I've also done extensive work with people or groups such as IP Australia and also the Australian Federal Police. With the Australian Federal Police, provided a program of mental health for all of their operational officers over a 2.5 to 3 year period. So there's a little bit about me. I hope that that is useful. Please feel free to ask any questions that are on your mind at any time. I guess when we think of mental health, we often actually think of more colloquial type names. Schizo, psycho, got a kangaroo loose in the top paddock, or a beer short of a six-pack, crazy, nuts, mental breakdown, cracked up, and the list goes on. We also tend to associate these types of terms with types of behaviours, and I guess the behaviours again that spring to mind here are things like distant, aloof, difficult to get to know, indecisive, aggressive, violent, all sorts of behaviours that again we may not choose to want to be associated with, whether this is in fact in the workplace or whether it's in fact in the community. And as we have seen from the advert for the seminar, that these types of issues are occurring in workplaces today, and they're causing quite a disturbance, at least financially, as we'll see later in other ways, for Australian business, losing up to over $6 billion per year. Well, let's have a look at what we are going to cover today. Essentially, we'll be going through 4 or 5 particular areas. And I should just check that everybody got a copy of the document that we sent a little while ago, which is a survey that I'll get you to do towards the end of the presentation. So if you could just let us know that you've received that, and if you haven't received it, also let us know and we can arrange to send a copy to you. So we'll have a look broadly at understanding mental health issues, then what impact that they have. And when we look at impact, we'll look at both nationally and right down to the personal level. How do mental health issues play out in the workplace? Look at your mental health, and then look at the sorts of things that you would be able to do for yourself, for your organisation, or indeed for people in your workplace. Good way to start any presentation is, I guess, to understand what it is we're actually talking about, and I've got a definition here for you to read on mental health. Let's take a moment to have a look at that. So some of the key points about the definition. First of all, it's an agreed definition from Australian health ministers from 1991. And it is a statement which, as you can see, is relatively positive in nature, because mental health, in fact, is generally at least a neutral thing. It's when we have a problem with mental health that we then need to work out Well, what is that problem? So a mental health problem is another way of saying a mental health issue, a mental illness, or a mental health disorder. Let's have a look at what the definition of mental health problem is. So as you can see there, the two key aspects for defining a mental health problem are that, first of all, there is a major change or changes in the way a person thinks, behaves and functions, and that secondly, there is a disruption to their ability to function effectively, whether that be in the workplace or whether that be in the community at large or at home. What I might ask you to do is type in and send to me what you think the most prevalent mental health problem or mental illness is within Australia. So I'll give you a couple of seconds to send me in your answers. Okay, well let's have a look at how everybody fared with this following table. I'll just give you a moment to look at those figures and then I will describe where they came from and what some of the important aspects to those statistics actually are. All right, the data is Australian data. It was a national survey of health and wellbeing conducted by the APS in 2007. It's actually a follow-on study from the initial one that was conducted in 1997, and I'll make reference to that in a little while. The study looked at 10,600 households for Australian adults aged 18 to 65. So what they were looking at is the general population. The study didn't cover places like prisons, where we know that there is a high incidence of mental health issues, albeit in a small proportion of the population, and in homeless people and other areas like that. So hospitals would be perhaps another one. There was no survey done of hospitals. So it's a general population survey. Some of the key things that we find about the survey is, first of all, that the most prevalent disorder for females is an anxiety disorder, and that's in keeping with the 1997 data. Second, that the male prevalence, most common disorder there, is also anxiety disorders. Now, interestingly, in 1997, it was substance use disorder that was the most prevalent disorder for males, and that was at about 11%. So there's been two things happen for males. First, there's been a drop by 4% in their use of substance use disorder, or if you like, their establishment of a disorder under that label. And secondly, that it's no longer the top disorder. The top disorder for them is an anxiety disorder. To quickly explain some of those disorders, an affective disorder is essentially a mood disorder like depression, and that is the one that we will refer to probably mainly throughout the presentation. An anxiety disorder, as we'll look at, has something to do and is anxiety related and can include things like generalized anxiety disorder, post-traumatic stress disorder, panic attacks, all of the phobias or fears, and there's another swathe of or range of anxiety disorders. You might also notice that if you add up any of the tables, that the bottom figure actually differs from the rest of the column. And the reason for that is that many people may display dual symptoms, i.e. they have comorbidity, which means they have more than one disorder. And the final thing that I'd like to point out in relation to our table here is the 20% figure. That is consistent with the 1997 findings, and as you can tell, that's 1 in 5 Australian adults in any 12-month period will actually have a mental disorder of some type. So that's approximately 3 million people in Australia, which, given the population is only 22 million, is quite a high number. Let's focus now on one or two of the more common disorders and the ones that we're perhaps most likely to see in the workplace. The first one is depression, and depression is obviously seen as some sort of low mood state that can impact on people, and some of the key things that we need to know is that depression is not everyday sadness or the blues. So an example there would be, we often find it difficult to come to work. We get Monday-itis, and that occurs sometimes on a Sunday afternoon and might last until we actually get to work and get our first coffee. However, this is not depression. Depression is when you have a number of symptoms across at least a 2-week period and that they are starting to affect your ability to work or have satisfying relationships. In this particular case, we're now talking about clinical depression that can be diagnosed by a mental health professional. The second main disorder that we will look at is anxiety disorder. And the first thing to look at is, what is anxiety? We all have anxiety, so you could say that that's common as well. And anxiety, or the fight, flight, freeze syndrome, enables us to take action when we need to motivate ourselves to solve everyday problems, or as many of our ancestors probably had to do, avoid dangerous situations. Anxiety differs, therefore, to an anxiety disorder. While we all have anxiety, not all of us, as you saw, will have an anxiety disorder. In fact, it was approximately just under 15% of Australian adults at any one time in a 12-month period will have an anxiety disorder of some nature. So how does an anxiety disorder differ from anxiety? Let's have a look at it. First of all, it can differ in terms of severity. Second, it will differ in terms of longevity, and the two crucial ones, it can start to interfere with a person's work or relationships, and it often occurs in situations where no threats actually exist. Because as you can see from above, anxiety is designed to allow us to do something where there is a known and seeable threat. What we find with people with anxiety disorders is they often have those physical symptoms of anxiety problems. However, there is actually no threat. And one of the things that can help them over time is to learn psychological or cognitive skills to assist them to interpret those symptoms in different ways. An important aspect of understanding mental health within the workplace is looking at the potential attitudes that might occur as part of the workplace, and that's what we'll have a look at through this short video.
People with a mental illness need the same understanding and support we give to people with a physical illness. It's rarely possible for someone with a mental illness to make their symptoms go away just by strength of will. Just telling someone to pull themselves together is not helpful in any way. Community attitudes have an impact on the lives of people with mental illness, their family, friends, and carers. People with a mental illness often feel embarrassed and reluctant to talk about it, as they would other medical conditions. Fear of other people's judgments can prevent them from seeking support or treatment.
Locking it away and treating people as if they've got some medieval visitation from the devil, instead of the fact that it's an illness, a condition like any other, then you start to change.
If someone moved next door to me with a mental illness, I'd probably be concerned, and I would be worried about my safety, I think.
Like, I wouldn't discriminate against them or anything like that. But
Myths, misunderstanding, negative stereotypes and attitudes surround the issue of mental illness. They result in stigma, isolation, and discrimination. This can mean that people do not seek help when they should, due to a fear of being labelled, or do not ask for or receive the support and consideration someone with a physical illness would get. The following advertisements were designed to promote a more accepting attitude towards those suffering from a mental illness.
Hey guys, my friend Laura said she'll do vocals.
What? The girl with diabetes?
Yeah.
Well, let's get her in.
Hey guys, my friend Laura said she'll do vocals.
What? The girl that cracked up last year?
Yeah.
1 in 5 people will suffer from mental illness. How much they suffer depends on our attitude.
Well, let's get her in.
All right.
Dad, is it okay if my mate Dominic comes along?
Doesn't he get asthma attacks?
Yeah, but he's on medication and he can look after himself.
Fine.
Dad, is it okay if my mate Dominic comes along?
Doesn't he have some mental problem?
Yeah, but he's on medication and he can look after himself.
1 in 5 people will suffer from mental illness. How much they suffer depends on our attitude.
Fine. Does he need a rod?
John, you remember Bill?
Who, Jonesy? The guy who had that terrible car accident last year?
Yeah. Well, he's coming back to work on Monday.
That's great.
John, you remember Bill?
Who, Jonesy? The guy who had a mental breakdown last year?
Yeah. Well, he's coming back to work on Monday.
1 in 5 people will suffer from mental illness. How much they suffer depends on our attitude.
That's great.
I don't have schizophrenia, though sometimes you might wonder. But I do know people who do. For them, their families and their friends, it's a terrible illness causing a great deal of pain and sorrow. But it is treatable. Medication, rehabilitation and support from the community can make their life worth living. If you need help or want to help, please call the Schizophrenia Helpline.
All right, now's a good time to hear from you, either through the chat box or over the speakers. Have any questions that you might have about the first part of what we've been looking at, which is just getting a broad understanding of mental health within Australia. Okay, nothing is yet, so we'll move along and on to the second section of today's presentation, which is to look at the impact. And the first part of looking at the impact will be at the national level. Now, to explain this graph for you, the first and most obvious statement is that whatever we're looking at is that mental health ranks as number 3, and you can see that in the graph that we're showing there. To explain a little bit further, it ranks as the 3rd highest health burden within Australia. It does that because the green, or the YLL, stands for years of life lost to that particular disease or to that particular issue. And YLD stands for years of life lost to the disability. So what it's talking about there is, in the first instance, they actually work out, for example, with cancer. If the average age of a man dying in Australia is around about 79, and somebody dies, or correction, a male dies from cancer at, say, 40, then that's 39 years worth of life lost to that particular disease. So that's how they calculate it. Obviously, with the disability, they calculate it from the time that the person acquired that particular disability, whether it be a mental health issue, a nervous system, some other injury, as you can see on the screen. And what we're seeing here is that whilst the years of life lost in terms of deaths to mental health is relatively low, as the overall burden is increased because of the impact of the disability. That particular survey was conducted, was called the Burden of Disease Survey, and it was done in 1996. So, moving on to the impact of mental health disorders on business. I mean, first of all, mental health disorders, the reason the asterisk is there is because in this particular instance they're defined as anxiety disorders, depression, and also the substance use disorder. We can see that there's a greater out of role per month for those people that have 2 or more mental health disorders, quite significantly more than when we compare it to someone who has no disorders whatsoever. So they have 4 on average 3.5 to almost 4 days more than someone who has none, which typically they only have 1 day out of role. Okay, looking at the impact from Comcare's perspective on the increasing cost due to psychological injuries, we actually see that in 2010-11 that 13% of all claims were due to psychological injury, and that 31% of the cost actually came from those 13% of claims. Now, we can see that the average cost per claim was about $205,000. This is a substantial increase on approximately 8 years ago, when the Commonwealth Government was paying around about $80,000 per claim, and the ACT Government, by comparison, was about $50,000 per claim. So quite a major increase over and above the CPI over those 8 years. Now, this doesn't include the hidden costs, and this is where this $6 billion figure came in for Australian business. I should say I have seen some different figures bandied around in the media, everything from $6 billion to around about $10 billion. And whilst those figures are a little bit rubbery, I think everybody's in agreement that there is a considerable impact on business from mental health problems. So what are some of the hidden costs that we actually have? And here's 4 or 5. First of all, we have a growing absenteeism issue. So often people, and absenteeism in this case includes being absent from work because they can't make it, and they'll make it because of the mental health problem, right through to the actual use of stress leave to assist the person recover from their particular concern. We can also see that there can be labour turnover, so where you have to replace potentially quite a useful and productive person because of a mental health problem. You need to go through all the costs that are associated with actually recruiting somebody to fill that gap. There may be workplace conflict, and as I discussed earlier on in the start of the presentation, there can be a range of different behaviours, and whilst we may not understand what's driving those behaviours in this particular case, they can lead to problems and conflict with colleagues and others within the workplace. Of course, there's the impact on well-being of both the person themselves and more broadly potentially in the workplace of their colleagues and outside onto their family. So these are some of the costs that we see happening to business and organisations. There's also a cost or an impact on an individual, and some Dutch research that was conducted on the global burden of disease has tried to make some comparison, if you like, between the loss of functionality between somebody with a mental health issue or a mental illness and somebody with a physical illness. So the scale that you can see obviously starts with 0 as there's low or limited loss of functionality, right through to down the bottom in the heavy red, the number 1, where there's almost complete loss of functionality for that person. So just to give you an idea, mild depression is around about the equivalent of someone who has epilepsy. Mild moderate panic disorder, which is one of the anxiety disorders, is around the equivalent of HIV positive. Mild to moderate obsessive compulsive disorder, around about the equivalent of anorexia. And the research is still a bit mixed on whether anorexia is actually a physical, a psychological, or a combination of both particular illnesses, but at the time the study was done, it was seen as being a physical illness. Moderate depression, about the equivalent of someone with severe asthma. Severe depression, around about the equivalent of somebody with intellectual disability. Now, if we think about that for a moment, and think about the sort of routine tasks or menial jobs that you may be giving to someone with an intellectual disability of less than 20, and what we're saying here, or certainly what the Dutch research is saying, is that that sort of functionality is what you can expect from someone with severe depression. The difference, of course, being is that for many physical disabilities, we may actually be able to see and understand the problem, whereas with mental illness, it can be sometimes very difficult to understand what is going on for that person inside them. So we may tend to view them differently. And the last one, severe schizophrenia, is around about the equivalent in terms of loss of functionality to someone with quadriplegia. So, to give you an idea, people who suffer from severe schizophrenia make up a high proportion, or rather a high proportion of people with severe schizophrenia are homeless. They find it very difficult to maintain a job or have a steady relationship of any type. And we also know that there is a high proportion of people just with mental health problems that are actually imprisoned. All right, once again, we've come to a new section, which is to start to look at what happens within the workplace. And before I go on, I might just take a minute's break just to see if we pick up any further questions, either over the audio line or via the chat box. Okay, so let's have a look at the workplace. A useful place to start is to think about what are the sorts of signs or symptoms that we are looking for from someone who might have depression in the workplace. And one of the first ones is decreased productivity. As I say to many managers that I work with, decreased productivity doesn't mean you have a mental illness, but it gives you at least a chance to ask a question around what is causing that decreased productivity. We might also see that it starts to lead to morale problems for the team or the people around the particular illness itself. There may be a lack of cooperation, and in some instances we may see safety problems or accidents due to the nature of depression, where its broader symptoms may include things such as mood swings, occasionally being quick to anger, forgetfulness, indecisiveness, inability to be motivated, and a host of other symptoms. We saw before that one of the issues can be absenteeism, as potentially the person looks to absent themselves from the workplace as a way to cope with the problem that they have. Often, people may be seen as the office whinger, frequently complaining of unexplained aches and pains. Sometimes they actually are the office whinger, but occasionally you may find that this is perhaps covering the fact that they have some form of mild depression and may need some assistance. And the last one is that the person may also have an issue with alcohol or possibly other drug misuse. This can be sometimes challenging to spot within the workplace. Certainly in my experience, sometimes the very obvious thing on the tip of your nose is the hardest to see. And when I was a manager in an organisation some years ago, I had an extremely productive young fellow who was a bit of an upcoming star. So that's what we tended to focus on. We tended not to notice how heavily that he was actually drinking, and it took just 2 years, certainly me included, to notice that there was actually an issue and he had a significant alcohol problem, and that was actually covering the second issue in his case, which was he was depressed. Once we actually worked that out, we're actually in a place that we could at least provide him or give him some support so that he could try and address those issues. Let's have a look at the signs of anxiety disorder in the workplace. Now, there are a number of these. I won't certainly talk to all of them, but they will give you an idea of some of the things that we can look for within the workplace. So I think the first point to take on board for the signs and symptoms of an anxiety disorder is one or two of these, if you like, does not necessarily mean the person has an anxiety disorder. And clearly we're looking for a number of these signs to give us an indication that there is something that's wrong, because going back to our original definition of mental health problem, we're looking for major changes that disrupts the person's ability to function effectively within the workplace or have satisfying relationships. So the signs and the symptoms should give you an idea that potentially something has changed for that person, and that whilst it may not be a mental health problem, at least you're in a position to perhaps connect them to some sort of assistance. Of course, the big one there that people tend to focus on, I suppose, is working longer hours and not taking lunch. Working longer hours, if you do that, which probably many of us do, and find it very easy to do without taking lunch, doesn't necessarily mean you have an anxiety disorder. It just means you work too hard, and you probably need to think about making sure that you have a break from time to time. Okay. Again, that's the end of that particular section, and now as we come into the next section, I'll just again allow you all to ask any questions that you may have. Again, either over the audio, or please feel free to tap something to us. And also, as we move into the next section and you're thinking about your questions, can you just confirm to our organiser that you do have a copy of the survey that I have sent to you? All right. We'll move into the next section, which is just looking at your mental health very quickly. And the first thing that we'll do is have a look at stress. Now, stress is any stimulus that tends to create an imbalance in our internal environment. That is the definition of stress. So a stressor can be a good thing or it can be a bad thing. Often when we talk about being stressed, what we really mean is we're actually distressed. So stress has become a negative in our lives or towards us. We don't often say that we are eustressed, which would mean that we're having good stress, even though that is an important part of our daily lives as well. So what I might ask you to do is take a moment now to fill out the survey that's been sent to you, and those results will be for yourself, so make sure you add them up, and once everybody's added them up, we'll then have a look at what those numbers indicate on the following slide. Okay, just getting an update about who's got the survey. I've got a question about the lunch break. Remember, it's just a sign, and by itself is not necessarily meaning of anything other than you might actually just work longer hours and do that by working over lunch. But if you combine it with a number of those other signs, then you're starting to get a picture that there's something deeper than just somebody that either enjoys working or has a habit about working those types of hours, or that lives in a culture or works in a culture that's the sort of thing that you do. So it is important to remember that when we are looking for signs, that we're looking for a number of those signs to give us an idea of the fact that there may be something wrong or challenging for that person. All right, for those of you that have completed the survey, just to give you an idea, the survey asked a range of different questions, just getting a bit of a profile for yourself about how you handle stress, how you deal with it, and where you currently are at. And as you can see there, if you've scored a very high mark, then I guess my suggestion to you is have a think about what you can do to ameliorate or reduce stress for you, whether it be in your life or in your workplace. And we will come to that in a little while as well. I've got your comment there. It is certainly an interesting one about the lunch break. And indeed, I know you've raised the point there about longer lunch breaks and extra breaks, and that could be tied to the absenteeism. Remember also we talked about alcohol, and certainly I had a friend of mine recently who asked me about a colleague that we both knew in a workplace and suggested that the particular person had potentially an alcohol problem. And the reason for that was because they were going on long breaks, taking long lunches quite consistently. And I suggested that that might be, depending on what the other signs were, that there might be something else for that person. There may also be a second issue. So I'm yet to hear what the ramifications are at this stage. So we've looked at the problem, which is a mental health problem within the workplace. We've had got a bit of an understanding about its potential impact, whether it be on ourselves, our colleagues, or our organisation. And what do I do with that information now? Well, how can I go and potentially assist either myself or someone else or the organisation? So we'll have a bit of a look at the different things that can be done. So first of all, for the individual, we can recognise some of the signs and symptoms. Now remember, today in the seminar it's only been maybe 45 minutes to an hour, and we've really glossed over those symptoms very quickly. In longer courses and training, you would get a better understanding of all the different signs and symptoms of things such as depression, anxiety disorders, psychosis and substance use disorder. However, even without that information, you do know that you are looking for something that has a major change for the person and is disrupting the way that they function and work effectively. We can use the life steps, so we listen actively, and probably in brackets I would say we can also make our observations about what is going on for the person. We can start to make any inquiries about risk to the person. Now, we don't have to say, are you thinking, is the risk to you that you're going to do something stupid or whatever the case might be? That's a separate conversation for another day. But what we're inquiring about in relation to risk is we're just trying to get an understanding of the impact that this particular thing is having on the person concerned. So what I mean by that is you don't need to diagnose necessarily or understand that the person has depression or that they have an anxiety disorder. You just can see that they're having a major challenge because their work has been disrupted based on your observation from the different symptoms that you've looked at, and that you can inquire about how they're going. And that is actually an inquiry about risk. It allows them to have a conversation potentially with you that they are struggling, they are finding something challenging, and that leads you to step 3, which is to have a discussion to find out what resources there may be available for them. They may actually have a good relationship with their GP, or they may be unaware that your organisation has an EAP and support services available, so you can look to connect them to those sorts of things. And fourthly, we can then assist them potentially, or they can start to assist themselves along with other colleagues and their community support to establish and encourage resilience. Moving on and looking specifically at an individual problem, let's say someone has a panic attack. A panic attack probably conjures up in most people's minds somebody is completely out of control and panicking and being unable to calm down. And if you were thinking that, or that was in your mind, then yes, that is a panic attack. But there is gradients, if you like, or grades of panic attack. So I have had someone who has walked up to me and looked as calm as anything, and I thought there might have been something wrong, so I simply said, is there something the matter? Can I help you with anything? And they said, no, not really. I'm having a panic attack, but there's nothing that you can do. I'm just going to take myself for a walk. Now remember that a panic attack is an anxiety disorder, and that an anxiety disorder is a very physical thing that the person feels, and they then interpret those symptoms in a certain way. What this person had learnt to do was to interpret them in a different way. It doesn't stop the feeling, it doesn't make it any less pleasant, but at least in a rational sense they can control, I guess, the panic part, even though physically their body is still panicking, if you like. So what do we do? I put call an ambulance there, but really what I'm talking about is any first aid type support would be invaluable if you're feeling that you lack the ability to assist in this particular situation. Can we get the person to a quiet, safe place that's away from any potential things that might be contributing to the panic? Can we assist the person to perhaps start breathing more effectively? Obviously, we reassure and stay with the person as we do in any first aid scenario until perhaps relieved by somebody who is an expert or a professional in the area. Right, moving on and thinking about for the team, some of the things that we can do for the team is to look at some basic awareness training across mental health issues. You can attend seminars as you are doing today, or indeed you could potentially lead discussions in your own workplace around mental health and different attitudes. Again, you don't necessarily need to be a mental health professional to talk about different attitudes in relation to mental health, as we saw from the earlier video. But you can use the video, perhaps, or something like it, as a prompt to get an understanding of how people view mental health or mental health problems within your workplace. And you can monitor attitudes and also behaviours. Let's move on and have a look at the organisation. So what we can do for the organisation is we can get a baseline of the sort of health and safety behaviours and attitudes that are required, and from there we can develop and look at any existing trends that we might have in the data that the organisation collects around absences, conflict, compensation claims and the like. Once we've done this, we're actually in a position to end an organisational program with the eventual outcome that what we're trying to do is improve the health and safety environment, which after all is pretty much a WHS duty of care responsibility from organisations, so that we can increase the discretionary performance and outcome that we get from the people that are part of our organisation. And there's been some considerable work done in that area, certainly in the UK, and some good work done in Victoria around the impact of stress within the workplace and what we can do to offset it and provide mentally healthy or more resilient workplaces. Okay, for yourself, what can you do? Again, the survey was designed to get you thinking about anything that's contributing at the moment to your particular levels of stress, and if you were feeling quite, or if you did record a number that indicated you were quite high on that particular survey, then it's probably worth thinking about, can you introduce a new habit or change of behaviour that enables you to perhaps reduce that stress over time. So some simple ideas here, thinking about walking at lunch, 5 minutes of meditation, reading a book, had some other suggestions today about riding a motorbike and the like. I think it's important to understand that for yourself, whatever it is you do identify, that you enable yourself the best chance to put it into action by making it simple. So start with something that only takes you 5 minutes. For myself, when I'm at work in the office, I find after a long period of time that something that improves how I'm going and what I'm thinking about is actually just to get up and go for a bit of a walk around the office and have a chat to anybody that looks like they want to have a chat with me, which can be a bit dangerous, I must say. But that's something simple that that I can do that then gets my head out of what I'm doing and allows me to re-energize for the next part of what I'm up to. So think about whatever that one thing might be for you, and I'd encourage you to write that down. And in this case, you can't share the idea with the person necessarily next to you in the webinar, but hopefully there's somebody close by that you can perhaps share your idea with. Maybe by the time we finish you could head off to afternoon tea and actually use that as an opportunity to have a chat about the thing that you'll put into practice for yourself. That brings us to the end of our presentation on mental health at work, and we've looked at essentially its impact within the workplace and had a brief look at your own mental health, and then a couple of different ways that you could go about assisting yourself, your team or your organisation. I'm very pleased to stay on the line for a little while now and open the floor, if there is such a thing in a webinar, to any of you that would like to ask some questions or indeed make any comments. Okay, that's an interesting question. I think it's supported with two questions. So what depth of mental health training is acceptable to deliver to staff? And the sort of follow-on there is it possible to go too far? So I think the question, and correct me if I'm wrong, is basically saying, so to what level should we go? And we're really talking about ensuring that the people have an awareness as opposed to trying to turn them into clinicians. So the sort of training I'd suggest that would be useful would be looking at things such as signs and symptoms so that people can have an understanding of what they're looking for in the workplace. There's no real need for people to be looking for causal factors. That's certainly not our job, if you like, as lay people. And a good way to think about it is first aiders which is essentially people that have 1 or 2 days of training that they refresh every year in how to help people in a physical scenario. They're there to provide immediate assistance to someone who may require it before the professional help arrives. And this is exactly like what you could do with your mental health training. You could simply provide awareness training, which might consist of seminars, or you might go for training consisting of 1 or 2 days that allows people to get a much deeper understanding of the signs and symptoms and to be aware that somebody might have those signs and symptoms and then be in a position to be able to suggest or connect them to the professional help that might be available either in the community or the organisation. So I think that's a good question there, certainly about can you go too far, and I hope that I've addressed it effectively for you. Okay, we have another question. Do you find that in recent times that the general society and business are more accepting of people with a mental illness? Okay, that's a really good question, and I'm going to answer that as a yes. And I'm going to answer that as a yes because I have been, I guess, providing training and awareness to businesses and the general public over about a 10-year period. And in that 10-year period, what I have certainly noticed is probably 2 major things. First of all, the bigger organisations that operate in this sphere, such as Beyond Blue, SANE and the Black Dog Institute, have got an increased profile within Australian consciousness. Interestingly, Beyond Blue, which was initially set up as the National Depression Initiative, has now turned its attention to also focus on anxiety disorders, which tells me that in their view that depression is reasonably now well understood within the general public. The second point that I would make is we have started to see a lot more people, a lot more profile people within the country actually acknowledge that they've had a mental health problem of some type. Easiest for me, I guess, to think about sports stars. So Andrew Johns, for example, who's was in fact a very good league player, acknowledged that he had bipolar. We've recently had an Australian general who returned from Afghanistan, and he wrote a book about post-traumatic stress disorder. So there's certainly an increased acceptance and increased coverage in an effective way within the media around these issues, and I think that is certainly helping. Okay, we have another question. Okay, that's a good one. You should get a chocolate for that one. From a management point of view, how do we separate stress and stress-related complaints, etc., from a mental illness? Okay, and my suggestion there would be that it's not arguably your job to separate that. It's up to the clinicians to make that determination. It's probably at the management level, the job of managers and management to identify that there is a problem, and then to enable the clinicians and the professionals to actually determine what it is that actually has happened to the person, which then enables the effective treatment and processes to be put in place to assist the person. I will say this is certainly one of the areas that I think are beneficial for organisations is improving what's called their mental health literacy, which is simply a way of saying their understanding of mental health issues. One organisation that I did some work with some years ago, their issue was they called everything stress, and there was quite a high proportion of people using the term stress because they didn't have the requisite knowledge to actually be able to say what it was that was really occurring for them. So we provided some assistance to them in understanding the different aspects of mental health, and that helped people to get a clearer picture of what it was that was going on for them. Okay, and another question. What are some programs or activities, what are some of the programs or activities that you have seen successfully implemented in an organisation to reduce stress, such as during lunch or short time periods? Okay, excellent question. And I've seen a number of different opportunities provided in environments to assist people. I know organisations, for example, that provide Tai Chi They provide meditation, they provide yoga, they do Pilates, they provide the more physical although you could argue perhaps the quicker physical activities such as boot camp, health and fitness classes. So all those things are useful to certainly reduce our stress. There's a friend of mine who does a considerable amount of running. Why? Because it reduces her stress levels quite considerably. Some of the other programs and activities that I've seen successfully implemented on a sort of non-physical front, so looking cognitively or psychologically, if you like, and also emotionally, is things to do with emotional intelligence and getting a greater awareness of how you think and feel, and how you can change how you think and feel that then allows you to create better thinking patterns for yourself and therefore also reduce your stress levels. A lot of the best programs are around cognitively based techniques, in other words, techniques that are designed to make you think in more effective ways. So ladies and gents, that ends to today's webinar. Thank you very much for attending, and I thought the questions were excellent, so thanks to those people. I look forward to perhaps speaking to you again on another topic of interest. So thank you very much and goodbye.